Hello guys on YouTube, this is SJ. This is my second time posting a video about anatomy. Last time I talked about neck and shoulder pain, and this time I want to talk about chronic ankle pain. Because the ankle is one of the most important parts in our body. It supports your whole weight, which means it's also vulnerable to any kinds of damage too. So when you walk, when you run, when you jump a wrong way, anything can be damaged. For example, this bone-to-bone connection, which is called ligament. This ligament is called calcaneofibular ligament because it connects fibula bone and calcaneus bone. And also, when there's muscle to bone connection, it's called tendon. So when you see this fibularis brevis, and it connects to the bone here, thin, strong strap. So basically, there's so many tendons, ligaments everywhere in under your feet, lateral, medial side of your feet. Multiple of them can be damaged. Single one of them can be damaged, but it tends to be become very chronic easily because it's one of the most used body parts in our body, as I said, and it can be damaged if it's not healed properly. So, for example, in the winter, in November or December, when it's not very cold, things tend to freeze, but it's not thick enough for us to skate over, right? So there's thin ice, but if you keep stepping on it, even until January or February, it's not going to be thick enough. It's the same with your ankle because if you overuse it every time before it gets fully healed until it becomes thick ice, you play soccer, you play basketball, you play tennis, it will over damage. It keeps damaging, so it'll become hard and hard. And when you become 30, 40, 50s, it'll be chronic at the end. So that's why it's important to treat it as soon or as properly as possible before it becomes chronic. So let's now talk about the anatomy of the ankle or where it could be easily damaged. So first I want to talk about the ligaments, bone-to-bone connection, as I said, because these 1, 2, 3 is one of the most damaged ligaments when you walk the wrong way. So when you have to walk this way and when you walk this, it can be easily damaged, these three. So this is called anterior talofibular ligament, and this is calcaneofibular ligament, and this is lateral talocalcaneal ligament. So when there's damage into your ligament doesn't extend. Ligament rips because it's not the material that extends. So when there's a rip in your ligament, it may be recommended to stay in same position and let it heal for it'll take like a few weeks or month. But at first, when there's damage into this surrounding tissue with the ligament, there may be swelling, there may be redness, there may be pain, inflammation. So it is recommended to just take non-steroidal anti-inflammatory drugs and also ice massage until the swelling is gone. So then it'll be able to be accessible without going into the swelling, because we don't want to do that especially with acupuncture. So after 5 to 7 days, when the inflammation is a bit down and there is not much swelling around, and then the acupuncture can be maybe accessible to it. If you have hard time visiting acupuncturist clinic, it is recommended the massage called deflection massage. So deflection massage is it literally says fraction. You're causing the friction between. So you just basically rub the damaged tissue, not until it's painful. Don't do it until it's very painful. Just do it until you feel a bit warm, you feel a bit massage type of pain. Your body will acknowledge that pain is there, and it will invigorate the circulation of the blood inside there and enhance the healing process. Yeah. And also these 2-3 ligaments, the pain will be under your malleolus, your lateral thick bone in your ankle. That's the malleolus. Lateral malleolus meaning outer side of your ankle, and thick bone. So it'll be below your malleolus, as it says. It'll be below. But if there's pain behind your malleolus, it tends to be these tendons, these two tendons, fibularis brevis and fibularis longus muscles. It connects behind and it goes down until you're outside of your feet too. So when there's pain, when you try to turn your feet outside, it tends to be these muscles because it overextends, and then when you try to put it outside, it overextends. So when you massage this, as I said, diffraction massage is very good. You just keep rubbing on it, but also this muscle body is here. So it's very lateral or outside of your leg, of your shin bone. And then if you press on it, it'll be a bit tender because damages into your tendon. The body will also have pain too. So we just keep pressing on here too when there's no more inflammation and you feel okay. Just keep pressing on here too. And you basically have to press it a bit stronger than down there, a bit tender. Like you don't want to press it very hard here, but you have to press it pretty hard here. And of course, acupuncture can be inserted here, but when you insert it here, you basically have to go a bit deep so it reaches the good body of the muscle. So we talked about below and behind of your malleolus. Let's talk about front side. So this is a ligament, anterior inferior tibiofibular ligament. As the book says, it's really rare to see this damage, but if there is damage, you have to how to differentiate is that, let's say your feet is like this is my feet and this is my ankle. You try to put it up, but I'm gonna put my hand here. You try to put it up yourself, and if there's a pain that way, the tendons are the problem because tendons of these muscles try to put these up. It's called dorsiflexion. So when you try to dorsiflect, it'll cause the pain with the tendons. But without it, when you try to put it down yourself or put it up yourself, if there's pain, it's high percentage of the ligament problem because there's no pressure that is made to lift it up or nothing. So when I press it, tendon. When I don't press it and you try to do this, it's the ligament. In terms of acupuncture treatment, you basically have to go pretty deep into this to meet this ligament, avoiding these tendons. So as I said, as we mentioned, let's talk about the pain when you do this. Dorsiflexion, plantar flexion. So when you dorsiflex, muscles that are used is these. Tibialis anterior that goes down here, an extensor, digitorum longus that is controlling your feet, digitorum hallucis longus, which is your thumb of your ankle or your feet. So when there is pain here, of course it's important to do diffraction massage here too, at the tendon itself, but it's very important to massage front of your shin too. So in these, this is your knee, right? Right below your knee, of the outside of the shin bone, this is a shin bone, to the right side, let's say on your feet. So if you're looking from up and down, it's right side. So when you have pain that goes here to the inside of your ankle, like this, you have to massage here too, with continuing on the diffraction massage on the inside. and also extensor digitorum longus. You keep pressing, giving the tenderness until it's not very painful. You keep pressing it, it'll be very helpful with the pain below your ankle. And also, let's talk about the inside of your ankle. So it's very rare for these ligaments to be extended. But if you have flat feet, if you have severe level of flat feet, these tendons and ligaments inside of your ankle is always extended. It's always so when normally it's like this, when your feet is like this, but if you have a flat feet, it goes inside. So the tendons that normally is like this long, it's like this long. So for example, tibialis anterior is the main one of them, and also these ligaments are the representing. So when there's, as I said, when there's a pain in the front or inside, it goes inside, you have to massage this right off your shin bone. But if there is a pain behind your inside malleolus bone, inside the thick bone on your ankle, you have to massage these. Tibialis posterior muscle and flexor hallucis, digitorum longus. And also flexor hallucis longus. When there's pain behind your inside malleolus bone, inside your ankle bone, do the diffraction massage or tibialis posterior, flexor digitorum longus, and flexor hallucis longus muscle. So let's see where the muscle goes. So for tibialis posterior, it goes inside. It goes behind your shin bone. Let's look at this way. See, if you see the blue one, it goes inside. So when you have to massage, you cannot just massage this muscle because it's not outside of your, even in the muscle group, it's very deep in there. So in this kind of case, or even extensor, flexor digitorum longus, so when there's pain in these deep muscles, tibialis posterior, flexor digitorum longus, and flexor hallucis longus, it is recommended to use acupuncture because it can go into the deep level of your muscles. When you have to massage these, it's better if you go these gastrocnemius or soleus muscle and just you have to press it a bit strong here. It's very hard to reach down there. So yeah, these are the three. Behind your malleolus, if there's extension, you have to press on it. So even if you don't have any sprain or run a wrong way, if you have flat feet, high percentage of the time, you will have pain here if you press on here, which is pretty common. So don't worry about it too much. And also Achilles tendon, which is famous, the main source of support in your ankle. So when there's damage into this, you don't only massage here, you don't only treat here, but you also have to treat up here too, until your soleus muscle, a thick muscle in your back of the bone. So you have to treat all the way your gastrocnemius, soleus muscle, everywhere. You have to massage it yourself. You have to press on it, tenderness. You'll feel very painful, but just until you don't feel severe pain, it's better to massage it here. Also, very famous, plantar fasciitis. This is the fascia of the plantar side of your feet. So when there's inflammation around this surrounding, there's pain when you walk, when you run, every time. So, of course, diffraction massage helps. And the acupuncture, of course, helps. But this one, yeah, just as important too. When you massage it, you don't massage only like where the pain is. You have to massage deep here too, or here. When there's pain here, you massage everywhere. It's important to do that. That's pretty much it. The most important tendons and ligaments can be damaged easily. So let's now talk about why the acupuncture is a good treatment for this kind of ankle pain. So when your body is healing, there's inflammation. It's a healing process. Your body is making more fluid in there. Your body is increasing blood cells into the damaged tissue, so it heals up. But the important part is that the inflammation has no limit. So even after the ligament or tendon is healed, the inflammation can still be there. So it's not a magic that stops whenever it needs to stop and when it starts whenever it needs to start. It can be always there. It can be sometimes come and going. But that's why the acupuncture is helpful. When there is inflammation surrounding your muscle tissue, I'll show you the whole. When there's inflammation surround, let's say here, even though the tendons and the ligaments are healed, when there's pain, that means there's inflammation. It can be in your surrounding tissue. It can be nerve, it can be muscle. So when there's inflammation, it causes the pressure to the surrounding tissue and nerve, which is why there's pain. So that pressure needs to be released. But what can release that? It can be acupuncture, because it creates the little hole into the tissue and it relieves the pressure. So that means when you get rid of the pressure, that means the inflammation will also go down and it will enhance your rehabilitation process very quickly too. Same mechanism, bleeding cupping also. What bleeding cupping does is that you make a little small damages into your surrounding tissue and then you bleed out on the local area, which will get rid of the inflammation pressure too. So when there's any damages into your tissue, disc in your back, in the spine, and ligament in your ankle, tendons in your ankle or whatever, everything, if you give time, if you lay down and do nothing for 6 months, it will heal by itself. You don't need any kinds of treatment. But you cannot do that. We all cannot stay at the same spot for 6 months. So let's say that you need to treat it right, you need to move right away, but you don't do any treatment. As I said, it's like stepping on a thin ice in a pond several times every week until it gets actually frozen. So when there's actually thick frozen, you can play soccer, you can play tennis, but if there's thin bone, you cannot. Even if you do a little bit of workout or any exercises, it can be damaged very easily. So that's why you need a proper treatment. You need to make a thick, good, healed ligament or like tendon, or it'll become chronic at the end. And when you age, when you become 30 years old, 40 years old, 50 years old, 60 years old, the pain will still be there, and you will never know why the pain is still there. With the same mechanism, the athletes from soccer, from tennis, from basketball, that's why they retire very easily, because of the chronic ankle problem. Because as an athlete, you need to show your performance as much as possible and as soon as possible. But when you damage your ankle, as I said, you need a proper treatment for several weeks. But if you don't do that, it'll become chronic because it'll get damaged every time. So at the end, they will be on a support, like a wheelchair. So it is recommended the acupuncture is one of the most effective treatment. It is actually used by a lot of people in Korea or China. So I hope this information helps, this general information about your anatomy. As I said, please use the friction massage. Even if there is pain, don't do it until you feel that you are gonna pass away. You just rub until it's warm, and that's good enough. And also, as I said, don't only do friction massage here. As I showed you, use the muscle body too. You have to keep pressing on the muscles. It'll be painful too, but you have to do that. It'll be very helpful. If there is something, a pain that you never know why it's there, don't just press on where the local pain is, press on the muscle body too. Okay? Alright. Thanks for watching, guys. I'll see you with a new video next time.